Hello, and welcome back to the channel. It's your community health safe space, and today the journey continues, advocacy continues, healthcare discussion continues, and I'm looking forward to your comments, your responses, and your questions in the comment section. Let's get the journey started. Our conversation never ends. So, understanding rural hospital shortages is the mission today. Not just understanding, but why this happens and the impact it will have on our communities and on our families in general. So, as usual, we start with a scenario, and today is no different. The scenario is, it's 2:17 a.m. and a mother in a small rural town feels a sharp pain in her chest. The nearest hospital used to be 12 minutes away. Now it's 48. Because that hospital has closed. And when rural hospitals disappear, they don't just take emergency rooms with them. They take jobs, maternity wards, mental health services, and a community's sense of safety. We're talking about a crisis that's quietly spreading across America, one that affects rural families first, but eventually touches us all. This is understanding rural hospital shortages in America and how it impacts communities near and far. Now let's take a look at what's happening to rural hospitals. Across the United States, rural hospitals are closing at alarming rates. According to the American Hospital Association, hundreds of rural facilities are financially vulnerable. Since 2010, more than 100 rural hospitals have closed nationwide. States in the South have been especially impacted, including North Carolina, Texas, and Georgia. When one rural hospital shuts down, entire counties can be left without care. That's without emergency room, labor and delivery units, yes, labor and delivery units, trauma care, and behavioral health services. And for many families, there is no backup plan. So, why are rural hospitals closing, you ask? It's not just low population. Here's what's driving the crisis. 4 things. Financial strain. When we say financial strain, we talk about rural hospitals having severe, higher percentages of uninsured and Medicaid patients, often reimbursed at lower rates. Workforce shortages. These include a national physician shortage, but it's even worse in rural America. We have aging infrastructure where older buildings, outdated equipment, and limited specialty services become an issue. With Medicaid expansion gaps, states that did not expand Medicaid under the Affordable Care Act saw higher rural hospital closure rates. This isn't about mismanagement, no. It's about structural vulnerability. Now, there is an impact on families, of course. When a hospital closes, maternal care often disappears first. Rural maternity units are among the fastest to shut down. This means longer travel times during labor. So can you imagine being in labor and your closest hospital could be somewhere between 45 to an hour or maybe more? We have higher risk pregnancies that are facing this situation as well, and increased infant mortality rates because of this. For chronic illness patients, diabetes, heart disease, cancer, routine care becomes a logistical battle. for mental health, access becomes nearly impossible. The consequences of these shortages become a ripple effect. There is an economic fallout. A rural hospital is often the largest employer in that county, a major economic driver, a stabilizing force for small businesses. And when it closes, jobs vanish, property values decline, young families move away. Healthcare access affects whether a community survives or not. Now, there's the urban versus the suburban question. America should care about this. It is of importance. And if we ignore it, then it becomes what we call a crisis. You might think this doesn't affect you if you live in a city, but here's the truth. Rural hospitals absorb overflow during disasters. Yes, they do. They serve agricultural, food supply, and transportation workers. Because especially we have a lot of truckers. Simple example, we have truckers who may leave from one part of the state to do deliveries in a rural county, and they get there and they're not feeling well. Well, where do they go in case of an emergency? There's no hospital there. Rural health decline increases strain on urban hospitals. Public health is interconnected. It is interconnected. What weakens one region eventually pressures another. Now we're going to address some of the questions that were posed. Let's cross the street here. Okay, so some questions that we were asked and that we're considering are: why doesn't the government fund these? And here's the fact. Funding does exist, but reimbursement models and policy design often don't account for low patient volumes and high fixed costs. Another question: is this just about politics? It's about economics. We are not going to make this a political issue. We want to give the facts, give the information, so we could, as always I say, advocate. So, is it about politics? No. It's about economics, workforce supply, insurance structures, and demographic shifts. Can telehealth fix this? And this is a good question. Can telehealth fix this? And the fact is, telehealth does help, but it's not a fix. Telehealth helps, but without broadband access and local emergency services, it cannot replace physical hospitals. Telehealth cannot cover every need that a patient has. Are rural communities being forgotten? Many communities feel that way, especially when closures happen quietly. Now let's look at some of the myths that we often hear about. Rural hospitals close because people don't use them. That is a myth that has been going on for the longest time, and that's not true. Many close despite serving essential emergency needs. Yes, and as we discussed before, we'll see that even if an hospital is sitting and the community is smaller, if it's not funded and infrastructure falls apart and people start choosing to go further, it puts that hospital at risk. The other myth: big hospitals nearby can absorb patients. The fact is, travel time in emergencies can mean life or death. That doesn't need any explanation. The other myth, or final myth actually, this only affects elderly populations. The fact is, it impacts mothers, newborns, trauma patients, children, and working families. Everyone is impacted. Now, let's take a minute and let's think, because I want you to respond to this in the comments section. If you live in a rural area or have family who does, I want you to put your state in the comments section. Have you seen a hospital close near you? I'm asking that question because I want us to build a map within the comments section so people could actually see how many hospitals are closing within whatever state, whatever community, whatever county. A hospital is more than just a building. It's where babies are born, where strokes are treated, where accidents are stabilized, where hope is restored at 3 a.m. in the morning. When rural hospitals close, it's not just healthcare that disappears. It's security, it's opportunity, it's survival. This is the impact that closing a hospital has on each and every person within a community. And if we ignore rural America's healthcare crisis, we weaken the foundation of our entire nation. The entire nation is affected. Now, what I want to emphasize is the value of public health. Because in public health, we rise together or we fall apart. And this is why we discuss inequity, disparities, because what affects the least of us, what affects that community that you often don't even think about, will eventually get to your door. It will impact you. It impacts health. It impacts the labor force. So leave your comments, leave your questions. Let me know what you learned that you never gave thought to. And as always, I want you to take a deep breath. I am here with you. We are advocates together. This is your community safe space where meaningful conversation takes place. And until our next conversation, please stay motivated, stay informed, share with your family and friends. And if you haven't subscribed, please do so. Have a wonderful day.